Hey there, welcome back to Bernama Today. Thanks for still keeping it logged on to us here. And now we have the flagship interview for the day with Datuk Dr. Ali Nurgani, who's a consultant orthopedic surgeon with KPJ Hospital, as well as Datuk Dr. Abdul Wahab Ghani, consultant orthopedic surgeon, also with KPJ, speaking about treating back pain through a revolutionary new surgery. Gentlemen, how are you this afternoon?
Good afternoon.
Okay, brilliant. So thanks all for taking your time to come in. Now, back pain is of course a growing problem in modern Malaysia. Yes. I think all of us, we start developing back pain a lot earlier than even our parents or the generations before them would have, simply correct. Because we always spend so much of our time hunched over a desk looking at our devices, right? So let's talk a little bit about when does back pain begin to occur?
Well, it can occur at any age. I mean, even in childhood.
Oh, really? Okay.
Yes, but of course it's more frequent now in teenagers because of the use of the digital media.
That's right.
You know, and that's a problem with people sitting and watching and not moving their butts.
Pretty much, just staying in one place, fixated. So what does that actually do to our spines over wear and tear and the years?
Yeah, because basically our body needs to move.
That's right.
And the more exercise we have, the better the strength and the mobility of all your body parts, and the spine included. And so if you're sitting and watching, say, your handphone or the TV screen
for 8 hours a day,
for hours of a time, basically the movements of the muscles is not there. And when you do not have movement, of course, the blood flow to your backbone is not there also.
Right.
Okay?
So what eventually will be happening is perhaps a little compression along the spinal cord.
Yeah.
Right.
You get what is called, I guess, mild sort of ischemia in your back because you don't move.
Right, ischemia.
Yeah, because it's like your muscles. If you don't move your muscles, the muscle blood doesn't go to your muscle, isn't it?
Right. So let's say, but the option that a lot of us these days are left with is with our busy lifestyles, balancing work, family, career. It results in perhaps you get your workout in during the early part of the day, but then you spend a lot of the rest of the day sedentary. Will that also eventually result in back pain?
Yeah.
Yes, of course. I think I just want to bring up the issues of to be a bit more scientific. Talking about intradiscal pressure. Now, if you look at intradiscal pressure, it is highest when you bend forward. You know, when you bend, you bend to do something. Let's say you bend to vacuum the floor or something like that. That's the highest. Or you
bend to pick up something.
Yeah,
from
there's
the
a
floor.
position where you get the highest intradiscal pressure. If you were to measure the pressure in the disc, you know.
I see.
And then sitting is the next. So sitting is next highest. You see, and is worse than standing up. So standing up is probably better than sitting. And lying down, of course, is the best. But I mean, you can't do work lying down all the time.
Exactly.
Okay?
Right. Yeah.
So that's intradiscal pressure.
Right.
So when you sit too much, you are actually increasing your intradiscal pressure, and that can lead to weakness of the disc and prolapse of the disc.
I think one has to understand the problems these days. Everybody is sitting either at the office.
That's true.
Or at work.
Yeah.
Or wherever, watching television at home, because activity is not one of a means of sort of relaxation these days. It has become more a sedentary sort of lifestyle.
That's right.
And a sedentary lifestyle causes problems to your back. A lot of problems to the back. You know, even though we previously came to look upon back pain as a result of injuries and stuff, but I think the sedentary lifestyle is probably more injurious to your back.
It's actually contributing
even
keeping
more
you safe.
than the activity, is it?
Exactly.
Yeah, this is the problem.
So from there, let's move on into slip disc, herniated disc. Now, this is something that we increasingly hear of, even those of us in younger age groups. What actually is a slip disc or a herniated disc, and how does it happen?
Slip disc actually is not the disc slipped.
Okay.
I think it's just a misnomer. I mean, it's wrong term given to the wrong. I mean, to the condition. It's actually is broken disc.
Okay.
You know, the disc is made up of two parts. One is the outer casing, which is hard or stiff, and then the other, the soft part inside, which is called the nucleus, isn't it? So when you have a slip disc, actually the annulus or the outer casing is broken. So when it is broken or cracked, then the inner soft part can just seeps out, you know, can just come out and get collected outside the annulus or outside the casing, and that form a swelling. And since this is in limited space of the spine, it can press on the nerve.
So what are some of the early symptoms of having developed this herniated disc?
Yeah.
Well, slip disc usually is an acute occurrence. It's not a gradual occurrence. It's something which occurs because of a tear.
So there would have to be a traumatic event.
It doesn't necessarily need to be a traumatic
Okay.
event. It could be that you're having a cough or a sneeze. People get slip disc. Okay?
Right.
Of course,
That's pretty scary, right?
Yeah,
Which is
yeah.
about how a lot of it actually occurs.
yeah, it can happen that way. Of course, it can happen if you're carrying a lot of heavy objects and stuff like that, or even some sort of injury as a result of some trauma.
Right.
You know, but I guess more and more we are seeing just simple things causing slip disc, and usually people come up because they wake up in the morning, they haven't done their warming up or stretching exercises, and they bend forward and they get severe pain, you know, and that is a very frequent cause of slip disc or herniated disc.
So when we're speaking about the demographic, is there any particular demographic anymore that suffers from herniated disc, or is it literally just everybody in the general population?
Of course, you see the disc tend to break when it is soft. And
Right.
as you get older, the disc becomes stiff, so it doesn't break so much, but you get different problems. So you can say by and large it's affecting young people.
Right,
young
so we're actually
people,
playing some
20,
visuals
40s
over
like
there
that. Yeah.
of the herniated disc itself.
It will be adults between the age of about 20 to 50 would be the majority of the cases.
That's right.
That doesn't mean younger people can't get it and older people can't get it.
Very
it happens then too, but less frequently. Yeah.
Okay, so what would be the preventive measures? Because what you've described and the pain that those who've had herniated disc go through is incredible. Definitely we want to avoid that. How do you prevent it?
Firstly, I think to be fit.
Okay,
Okay.
to be generally healthy.
Generally healthy, have a good healthy lifestyle, have good exercises, do back strengthening exercises, extremely important.
Right.
You know, and having a proper lifestyle where you don't overstress your back. I mean, simple things like getting out of bed, carrying things, all this has a certain style which you should do. You know, bending forward and just picking up things is not good for your back, for instance.
Right, so you
Okay,
should
you
actually
should
be
squat.
hinging at your
You
legs.
should squat.
The way a baby would.
That's right. You squat,
Right.
carry, and lift. You know?
Okay,
What
right.
I want to stress for Malaysians is to take up swimming, especially the young people, especially ladies. But the problem now is that you don't get swimming pools, easily accessible to ladies,
Accessibility.
especially to ladies, especially to Muslim ladies, for example, because they are covered up and all that. So I think if you have pools, I think they must make certain days or certain nights for lady day or lady nights or something like
Right.
that.
So
for the
why
ladies to go in.
swimming in particular?
Yeah,
How does
because
it
if
actually
you
exist?
still afloat, your back pain, your back muscle has got to work.
Right, there
Otherwise,
you go.
you'll
It's
sink,
working
is it?
hard.
Yeah. So you want to
Okay.
make your back muscle work so that the muscle grows and becomes stronger.
So those are some of the parameters. Just take care of your back, have good exercise, strengthen it. Now, what are the current...
Avoidance. Let's go to the current. You're
Exactly.
talking about
So
current.
we're talking about what's currently available as a solution, and this is the meat and bones of why you're actually here today. You're here to share with us about a revolutionary new alternative for those suffering and living with back pain. Doctor.
Okay, we are now trying to talk about laser discectomy. Okay, this is a very new technique. It has been around for perhaps the last 15 years or so, but I think we have just recently brought it in, doing percutaneous techniques in Malaysia. Prior to this, the laser was available, but it used to use an open technique where you went in and then applied the laser to it. But now I think we have these percutaneous techniques, which make it simpler.
Right. Not invasive.
It's minimally invasive.
Okay.
Okay. And then, of course, the patient can then get up and get moving very fast.
Okay, sounds brilliant. Sounds like a perfect package, especially for those who have a busy lifestyle and who don't have the time to actually spend in recovery. Let's go into what is PL3D. So the full term for this is percutaneous laser diode disc decompression. Quite the mouthful, so we'll just refer to it as PL3D. What is this in essence, doctor?
Basically, it entails poking the back into the disc, putting a needle through the skin into the disc, and then apply the laser fiber through the needles, and then burn the disc using the laser.
I see.
All right.
Right.
Maybe we should just show what is the needle we use, which
Maybe
is a
the
very,
camera can focus on the
very
needle.
fine
It's a
sort
very
of
fine
needle.
needle.
That's right. If you could bring the camera back into focus, perhaps we could have a look at the percutaneous laser diode.
Yeah, and then you have
This
this.
is the needle.
Yeah.
You know? and the laser,
fiber.
goes into this,
Right.
very easily.
Okay, if we could just hold it up a little bit
I'll
higher
just
so the
pull
camera can
this up.
focus.
So we'll then introduce the laser into the needle so that you can see what the
That's right.
the thing does. It just basically goes in,
Right.
and then it treats. You see the tip of the laser?
Right. So that will
Right.
be turned on, and that actually treats the back pain in a very targeted manner.
That's right, very targeted.
So the laser is supposed to shrink the nucleus, so you get less volume of nucleus in the casing or in the annulus.
Right. So it does not actually
So
move around.
you're creating vacuum, one thing, so that you reduce the pressure. All right. At the same time, you are shrinking the nucleus.
I see. Right. So all the way from start to finish, how long would the procedure generally take, doctor?
One level, I think, is about 15 to 20 minutes, very fast.
I see. And generally, the patients who do come in for the PL3D, how many levels do they have done up?
Commonly it's one, but they can have two and even three, but commonly still one.
Right, I see. So is this considered an outpatient procedure for
No,
those who do come
no,
in?
we do it. You can do it as inpatient, and you can do it as a day case.
I see.
All right, but it's not an outpatient procedure. At least I think it's a day case, because sometimes we do give sedations for patients to be comfortable for the procedures, and they have to recover from the sedation. So they need a bit of rest, you know.
I
post.
think
procedure.
overseas in other populations,
Maybe
they do it as an outpatient procedure.
Yeah.
But I think in Malaysia, I think outpatients are a little bit more circumspect.
Yeah, I think you can.
Right.
You can, but you do it under local.
Yeah,
I think
so
outpatients
we,
a bit
we sort
scared.
of admit them.
Yeah.
And,
Outpatients a bit
and
scared.
keep
Just
them
as a
in the hospital
precaution.
for a while. That's
So
right,
we
yeah.
actually do have a video about the preacher test, which is one of the parameters of the treatment itself. Let's play that and have a look at that
Okay.
first. So if you could tell us what's actually happening over here.
Okay, that's the equipment, the needles and the laser fiber.
Right, okay.
Oh,
if
these
you
are
could just
temperature
explain what
studies.
this
This
actually
is
looks
temperature
like.
study.
Why is the temperature study
I mean,
integral?
This is done in lab. It's not. We don't do this every day. You know, it's
I
just
see.
information on the temperature. It's just within the localization of the fiber in the nucleus, so it doesn't hit any nerves, you know, surrounding it.
I
so it's
see,
very
right.
safe. The maximum temperature for this procedure is only 50 degrees, which is very safe for the nerve. You know.
Right, okay.
They don't kill the nerve.
So the procedure itself, for one to qualify to receive the PL3D treatment, what would the basic parameters be?
Basically, we would look at a patient who has severe pain and effect on the nerve, which is called sciatica. Okay, then they have pain usually shooting down the legs, and if the pain doesn't respond to the normal modes of treatment, which is medication and perhaps a period of physiotherapy, it's only then that we would recommend going on to something which is more invasive, like, even though this is a minimally invasive procedure,
Right.
we have to go through the normal protocol of going through the simplest procedures before we go
Understood.
forward. Yeah.
And what are we actually seeing in this video,
Okay,
which is playing
this
right
is
here,
also
doctors?
an experiment where they apply the disc in the lab, apply the laser in the lab
Right.
on the disc, and to show that this is shrinking actually.
I see,
to a
right,
small-
right. So showing how
small,
the mechanics
yeah,
of it
that's right,
actually
yeah.
works
That's right.
in real time.
Yeah.
Now, moving into another type of pain, sciatica pain. Now, this is something which people commonly experience as well, and it could be, symptomatic of some bigger problems in the road ahead. So how would you actually know that I am definitely suffering from sciatica?
Sciatica pain basically is pain which originates in the back,
Right.
and then radiates down into your leg. Okay, and it can be due to many reasons, but the commonest one probably would be prolapsed disc.
Prolapsed disc itself, right. Okay, so when we're speaking about the success rate of the procedures that you have both conducted so far, what are we looking at, the odds?
Okay. We have done a local study when we first started doing this in February last year. So I think we analyzed our result by the end of last year, and we found that we have about 95% success rate in terms of pain relief. Okay,
Wow.
in terms of pain relief, because we don't have the chance to repeat MRI for all the patients. You see?
Understood, naturally.
But recently, about a month ago, I think I did manage to repeat one MRI for one
A
of my
returning
patients,
patient,
and the disc normalized. You know,
Oh,
the
wow,
prolapse has
brilliant.
gone. Yeah.
Brilliant.
If we manage to keep repeating MRI when they come for follow-up, I think we probably will get a proper result. But you know, because MRI is costly as well, so we cannot just simply repeat all MRI unless you have a grant to do a study, you know.
That's right.
So, but so far, in terms of pain relief, we get 95% success rate.
Yeah.
That's right. So we also have some other videos to play, the cervical proprio video.
Yeah.
Can you explain to us a little bit about that procedure and why it's important to the PL3D?
Yeah, maybe you want to explain.
Okay, it's the same. When someone with come with neck pain, sometimes they have this pain radiating to their upper limbs. We call it
Right.
radiculopathy, and all these points usually to slip disc as a cause of the problem. So the only thing when you do a cervical, you know, PL3D,
Right.
we approach from the front rather than
I
from the
see.
back. Okay, because the disc is really in the front, in the neck.
Understood.
So it's very quite easy. The only thing is scary because, you know, people poking your neck. So most of my patients like to be under general anesthesia.
Understood.
The advantage of general anesthesia is that you can put a tube in the foot pipe so that you can see clearly under your X-rays. Okay? So you
Okay.
can push the foot pipe and the trachea to one side, and then you are just on the disc. Okay?
Wonderful. All right. Doctors, thank you so much for your time today and that very succinct introduction into one of the options available for back pain these days. Right.
Yeah.
To end with, any last tips for those out there listening, especially how to take care of your spinal cord to ensure that you don't end up with back pain or injury?
Have an active lifestyle.
Okay, all right.
Do exercises. Keep your back moving so that your back muscles will be strong.
Absolutely.
Okay, and avoid the sedentary lifestyle which we have these days with the digital media.
Okay.
That would be
Doctors,
helpful.
thank you so much for your time today. It's been brilliant. So we hope you found out that little bit more about how to take care of your back so that you can actually avoid surgery. But if you do need it, the PL3D is a fantastic option that is currently available now in Malaysia. I'm Tamina Kauji signing off for Bernama Today. We'll see you again next round.